Hi, my name is Stacey Lea Spahn, and I'm a student at the United States University. And I'm meeting today with Jean, who is my patient, and we are going to discuss migraine headaches. So, Jean, my name is Stacey. I'm a nurse practitioner student, and I've met with your primary care provider, and he shared a little bit of information with me. And it sounds like one of your primary health issues has been migraine headaches.
Yes.
Okay, so there's been a lot of research about migraine headaches, and a lot of it is showing that it is, in a lot of instances, inherited. So, are you aware of anyone in your family ever having a history of migraines?
My mother never complained about anything, and my dad, um, no, not that I can recall my father complaining about anything, and none
Okay,
of my brothers and sisters
okay.
let me know.
And typically with a migraine, there's many types of headaches, but it sounds like your symptoms are pretty specific to a migraine headaches. And some of those symptoms are nausea, sensitivity to light, sound, or head movement. And are these things that you experience?
My migraines are mainly, I get really nauseous, and light really, really bothers me. I have to lay down. I can feel it coming on. I can tell that I'm going to have a migraine. I'm going to have a migraine, and as soon as I get that feeling, if I don't take medicine in time, then
Mm-hmm.
I'm done for 8 hours. And
Okay.
through the years, I found that my migraines last exactly 8 hours
All right.
from the time of onset until the time I'm done throwing up.
Okay. So then you know that there's different stages to the migraine. Um, there's a premonitory phase, and these are symptoms, and it could be really, really strange, benign symptoms. Some people have like smells or certain things bother them. And this occurs sometimes up to 24 hours before they're even going to have the migraine. Do you ever notice any? Is there anything that you've correlated before you've gotten your migraines?
The only thing that I notice is like right before I'm going to get one, I'll start feeling nauseous, and
Okay.
I'll get a slight pain, like either behind my eye, or suddenly light becomes very sensitive.
Okay.
But it mainly I get nauseous, and I get the pain right behind my eye.
Okay. So that's kind of like some people have an aura. Sometimes can be sparkly light. So obviously for you, the onset of the nausea and then
The
that
lights.
light pain. So then when the headache does set in,
I
can you describe it?
it's it's hard to describe. It's just a horrible pain. I just lay down and go to sleep. I try to go to sleep.
Okay.
Um, every time I get very nauseous and nothing but dry heaves. But when you throw up, it's like every time you throw up, that pain is just so intense because you're putting so much pressure and there's nothing in your stomach.
Right.
But the pain is it's all just like on red side here. It's just horrid.
So, and those sound like really classical symptoms: the nausea, pain behind one eye or an ear, pain in the temple area. You can see spots or flashing lights. And as you're saying, you have sensitivity to light. There can also be sensitivity to sound, even temporary loss of vision or vomiting. But like you're saying, you don't vomit, you just get the dry heaves.
I don't um I haven't lost vision, but I do have sensitive hearing.
Okay.
I when I have the a migraine, I'm in bed in a dark room. My head is over a pillow over my head to get out the sound because it does. And if somebody makes a noise, I get nauseous. If somebody turns on the light, I get nauseous.
Oh, wow. Okay. So, some of the triggers that have been identified for migraine headaches are emotional anxiety, contraceptives, alcohol, hormonal changes, and menopause. But it appears you're not on any contraceptives,
No,
and you deny any alcohol use, and you've gone through menopause,
absolutely.
so you're past all of those points. But emotional anxiety, do you notice any issues with anxiety or emotional upset prior to any of these headaches occurring?
Um, it's kind of strange, but I always related my migraine headaches to dehydration. I can't see of where anything emotional would have caused it. But I found that I'm drinking more. I don't get the headaches as much as I was.
Okay. All right, and it looks like we said we've done your health history, which is actually pretty benign, except for some knee pain and then the migraines. physical exam looks good. Looks like you've had a CT or MRI of your brain in the past, your head, and,
Yeah,
and they cleared. There was nothing abnormal there.
Right.
So what we're saying is your diagnosis is based on classic symptoms: unilateral head pain, moderate or severely painful. It gets worse probably with activity, and even like you're saying, even someone moving and turning the lights on, throbbing on one side, worse than the other. Well, obviously, because it's one-sided, but increased sensitivity to light. Sometimes these headaches can last up to 48 hours. So you've actually honed yours in, so you know you're at 8 hours.
Yeah, as long as I get it into bed right away, if it's already started, I'm good. It's done. It's done 8 hours. But if I don't, I've got to catch it before it starts.
Okay.
And then I'm good. But it has never lasted more than 8 hours.
All right. And
ever.
Have you had to miss work or other activities because
absolutely. I've called in sick from work because there's no way I can handle this light.
Okay. There's other factors that your doctor, when we talk about educating a patient, it's not only about taking medication. There's things that you can do in addition to that. So this really isn't, this is patient education. We're motivating you to self-manage your care. And things you can do, and you may have already tried a lot of these, are changing your diet, because there may be foods or substances in the foods that you're eating that are causing this. Examples are alcohol and caffeine. Of course, we know you don't consume any alcohol, but I'm not sure how much caffeine you.
I only drink tea, and since I've cut, I used to drink soda, I guess it's called here. I call it pop. I've noticed I don't get them as much, so maybe the pop was related to it. I only have 2 cups of tea in the day, and then have nothing else. I don't drink any more pop anymore.
All right, and then prescription medications. From what I understand, it looks like you've got some pain medication for your knee, or an anti-inflammatory you're taking for that, and vitamins.
That's all I take.
Right. And then as far as reducing stress, you're telling me that that's not a primary issue.
No, I think I pretty much, at this age of my life, I'm pretty much saying it is what it is.
Okay. Well, let's talk about treatment. You told me that you have taken medication. So what do you use for your migraines?
Right now, what I started using an over-the-counter medication that's for migraines, and all this basically is a lot of caffeine and Tylenol. But that's all I really used, and it seems to, like I said, if I can catch it, it works. But if I can't catch it, I'm done for the day.
Okay, so then it sounds like you're probably using like a non-steroidal anti-inflammatory, probably even an analgesic, some ibuprofen or Tylenol type products with some caffeine in it. There is anti-nausea medication, because I know you're saying that's one of the symptoms that occurs with you. That's something we could talk about prescribing for you for like at the onset to help with those symptoms, if that would be helpful.
I found that once it starts, I can't keep anything down. I mean, I've even tried ginger ale, 7-Up, the old standby for calming your stomach, and they just did not work.
Okay. All right. Well, it sounds like the medications you are using, just so you know in the future, if you find that those are ineffective, there's other things we can prescribe. Sometimes stimulants actually will help.
What kind of stimulants?
Stimulant drugs, of course, caffeine is one. So
okay. So should I?
Because it doesn't necessarily. It can be something as simple as that. Caffeine obviously is a stimulant. So, but you said that's already in something you're taking. There's nerve pain medication, and nerve pain medication. Gabapentin is an example of that. Triptan is a type of medication that's specific to migraine and cluster headaches, and sumatriptan is an example of that. That's something that's available that helps treat the migraines. And the only thing that would probably dissuade you from using that is sometimes people have side effects. They may complain of typical symptoms of heart racing or irregular heartbeat, changes in vision or stomach pain, those types of things. But that's something, if we go down that road, we can discuss that then. Magnesium oxide has been shown that some of the studies we've seen, patients that have migraines do have a deficiency in magnesium oxide, which is a very easy lab test. We can certainly check that, because that's something that would be really easy. We could look at diet to replace that, or we could look at oral replacement. Acupuncture is also used quite frequently for migraine sufferers, and that, of course, it's a growing field, so that is very much available in the community here if you're interested. So really, for self-care, the main thing we want you to do is try to avoid those things that trigger your migraines. And it sounds like you've kind of identified that, you know, that if you're not staying hydrated well, that's something that can trigger them for you. You know, other things are, you know, if you're not sleeping well, if you have times when your caffeine intake, you might drink more than what you normally do. Stress management. I know you work in a really stressful job, so it's important to have downtime away from work to find activities that you enjoy. Pain control is going to be important too. You know, you have your knee pain, it's important to keep that under control, because that, of course, can stimulate other things in your body, and of course that can cause stress too. Sleeping habits, extremely important, and not only just for the migraines, but for your overall health. And same thing with diet. It sounds like you've got a really good handle on your diet, so you're aware of exactly what's triggering your migraines. So, do you have any questions? Is there anything that we haven't discussed, or do you need clarification?
What kind of tests can I do to find out what that you said that one magnesium or something I'm short of? How do I find out if I'm short of that?
That's actually a very simple lab test. Okay. We can draw that. Okay. And, I mean, that's something we can draw on sometimes the same day or the next day, have those results available for you.
Do I have to fast?
No, you do not. All right. So at this point, it sounds like you've got a good handle on identifying what's going on, you know, prior to your migraines. It sounds like you know exactly what to expect when you have them. So we can do these lab tests, and we can talk to you about the anti-nausea medication. Is there anything else that I can help you with today?
Nope.
All right. Well, thank you for your time.
Thank you for the help. I appreciate it.
Anytime. And if you have any additional questions, just let me know.
Absolutely.